Hello everyone, let's try to answer this question. Would a 5-component Apgar score be a quick assessment of preterm infants at birth, or should it be modified? What do you guys think? Okay, here's an example. So a baby is born at 23 weeks of gestation, and the baby appeared floppy with low tone. The heart rate is 80 beats per minute and is gasping. The color is difficult to assess. So what we did, a baby was provided with positive pressure ventilation, followed by intubation at 40 seconds of life. So at 1 minute of life, the infant is intubated, the tone improved, the heart rate is 140, and infant appears pink with saturation of 91%. So what should be the 1 minute Apgar score? If you go by this picture, if you go by this, the heart rate is 2, the color could be 1 to 2, the tone could be 1 to 2, reflex could be 1 to 2. But what would we do with the respiratory support? If the infant is intubated, how we are going to assess this patient in terms of Apgar score? Although the baby might be breathing, but still the tube is in because, for the need for surfactant and other stuff. So that's why this is very challenging in extreme premature baby to use a 5-component Apgar score. The other reason is, let me wipe it off. The other reason is to assess the tone and reflexes. It's very difficult to assess in extreme preterm infants. That's why we use Dubowitz and Ballard scoring, because their physical immaturity and because of their tone and reflexes, they are different babies. So using a 5-component Apgar score might be too much of expectation on these babies, and it's very difficult to standardize the tone and reflexes because these are really subjective observation. So what can we do? So here is some suggestion that we should be going more objective. So pulse oximetry is objective and the heart rate is objective. In fact, American Academy recommend, if the baby is requiring positive pressure ventilation, is good to use the ECG leads. And we also suggest that using point of care ultrasound to look at the heart rate. We have published a paper on it. But anyway, here for simplification, there are two ways you can measure the heart rate. One is by pulse oximetry and one is by EKG. Or you can use a stethoscope, whatever way you want. The problem is respiratory support in preterm babies. We suggest that if infant is intubated, then we should not score the baby more than 0 because infant does not have respiratory support. But again, this could be modified. This is just a suggestion. The neonatal community has to sit down and come up with a modified way of doing it objectively. Especially now, resuscitation could be done at the mom's perineum with the delayed cord clamping or deferred cord clamping. That way, we need to modify the Apgar score. I think the tone and reflexes should not be accounted for in premature babies. So let's go further. So these are two examples. Pause the slide and look, especially example number 2. That this way, you could, this will be reflective of the baby condition. Like for example, in the case which we described, by 1 minute, the baby is intubated, but the Apgar score is 8. So what does it mean? The baby is good? No, baby is still intubated. So Apgar score in extreme premature babies is not a reflection of what it was invented for or it was devised for. Basically, it was devised for healthy babies in terms of term babies who, a quick assessment, an Apgar score of 9, and 9 gives an impression to the family that baby is doing good. But with advent of time and technology, there is a need to modify it. If you guys have time, pull this article. This is published in Neonatal Intensive Care about 4 years back. So this is available online. So basically what we are suggesting is to eliminate these two element in premature babies and go more objective, like either use the ECG, point of care ultrasound, or pulse oximetry for the heart rate. And instead of color, we should, color is very subjective, but getting a pulse oximetry, which we use almost inadvertently in all premature babies, we use the pulse oximeter at birth. So that is easily, doable. And respiratory, the community has to, agree what they want to do with the intubation or non-invasive ventilation. Our suggestion is that intubated baby should be scored as 0 and the non-invasive should be 1, and an aggressive premature baby who is breathing should be 2. But again, like I said, this is just a suggestion. So review this article and please do comment what you guys feel about modifying the Apgar score in extreme premature babies. And you guys have a wonderful day. Bye.